We're here at MemorialCare Long Beach Medical Center, and we're diving into the division of interventional neuroradiology with Dr. May Noor. How are you doing today?
Doing very well. Thanks for coming.
We are obviously here surrounded with a lot of machinery. So do you explain to us a little bit as to how this interventional neuroradiology works on patients?
Absolutely. So what better month to talk about this than during Stroke Awareness Month? That's in May. And we are very fortunate with the advancement in technology these days that we're able to do many more minimally invasive procedures for patients, which are life-saving and brain-saving procedures. And we're able to do them very efficiently and swiftly thanks to the advancement in our technologies and techniques. So interventional neuroradiology, what it involves is treating any problems with the blood vessels of the brain or the spine or the neck or the face, and we do that without having a large surgery or open incisions or anything. We basically navigate all of our technologies and our devices through the blood vessels, whether that be the blood vessel of the leg called the femoral artery in the groin area, or the blood vessel of the wrist, the radial artery, or the blood vessel here. We can access all of the blood vessels of the brain. So accessing things in an endovascular way, think of it as Russian nesting dolls. We have many catheters, which are like tubes, and one fits into another, which fits into another, which fits into another, and they provide a tunnel and a pathway for us to treat medical problems, and specifically brain blood vessel problems. Time lost is brain lost. So if there's anything that we want to impress upon our audience today is that we have to get to brain acute emergencies fast. The reason being, for each minute where there's lack of blood flow to the tissue of the brain, 2 million brain cells die. And imagine the brain, I like to always say, brain is like real estate. It's all about location, location, location. So there are eloquent parts of the brain where returning blood flow fast is not so crucial, but there are very specific parts of the brain which control function of us understanding language, expressing ourselves, being able to communicate, being able to walk, being able to use our hand, being able to dress ourselves and feed ourselves, which are crucial. And for those brain cells, we must save them fast. So the most important thing is that for any emergency, somebody has weakness in an arm or a leg or a face, or speaking unclearly, not being able to get out their words, even loss of vision in one eye that's sudden. The hallmark of stroke is that things happen suddenly. People have symptoms right away, and they're sudden symptoms. One must not wait. Always call 911. That's the right answer, so you can get to the right place when you have time for treatment. So this machine is relying on X-ray technology. What we do is inject dye into the blood vessels of the neck and arm and leg as we navigate, and that shows us our pathway of where to go. And what you see here is a 3-dimensional angiogram. So what you see in black is the contrast that we see, which is being able to be seen by the X-ray beams. And this contrast fills the blood vessels in whatever shape they are, just like Jell-O filling a Jell-O mold. And so, for example, if there's an aneurysm that ruptured, which is basically a blebbing of the vessel that ruptured that caused bleeding into the tissue of the brain, then we can see that bump or aneurysm right away. And once we see that, we can target it, and we can use this as a roadmap or guide for us to put all of our catheters and wires and to treat the patient right away.
How quickly can you actually resolve or go ahead with this procedure?
Well, it's very swift, again, because acute neurologic emergencies and brain emergencies need time-sensitive response. And so we have a wonderful team of technologists, nurses, anesthesiologists, pharmacy, physicians, and so forth, and we all work very well together, and we all work in unison. We each have our jobs, but we all do them in parallel and unison because we do them together all the time. So we're used to being time efficient, and we're used to being understanding and targeting, what the treatment is. And we have many, many devices which we can use, which we can customize according to the anatomy of the patient. So we come in here, a patient comes in through the ER, we're notified that the patient is here, we get our team set up right away, the patient is here, and we all work together to get care as fast as we can.
When we talk about stroke, and especially in the adult population, we have two ways to deal with them. One is we have modified risk factors, which are things we can modify to reduce the risk of a stroke. and we have non-modifiable risk factors. And these are things that we really can't change. That includes genetics, age. But modified risk factors are like high blood pressure, diabetes, atrial fibrillation, high cholesterol, and smoking, which are factors that you can adjust to reduce the risk of a future stroke. We do check for all these factors when the patient presents here to make sure those are controlled when they leave our hospital, or at least are started to be controlled, because that's what brought them here. One of those modified risk factors caused the initial stroke, and what we want to make sure when they leave our institution, those things are known for the patient and they can deal with it in the future, so they reduce the risk of a future stroke.
So as you have seen and heard, MemorialCare Long Beach Medical Center is one of the most comprehensive stroke centers. So if you want more information, do head on over to memorialcare.org/BeFast. Act fast, and happy Stroke Awareness Month as well. I'm one of your hosts, Yasmin Tamris on Long Beach Local News. Head on over to longbeachlocalnews.com.